Welcome to Voices of Experience. I am Dan Mikel, President Emeritus of the Minnesota State Retiree Council, AFL-CIO, and today we'll be talking with our good friend Steve Francisco, the Federal Policy Director for the Minnesota Council of Nonprofits. Steve has been with us on several other programs and has in fact received an award from the Minnesota State Retiree Council for his outstanding leadership and political expertise in healthcare issues by the Minnesota State Retiree Council. He helps promote our interests. Today we'll be looking at three issues: healthcare, the Affordable Health Care Act, the draconian so-called Ryan budget that's being mentioned in Washington and elsewhere, and Social Security. Steve, welcome to Voices of Experience.
Thank you, Dan. Good to be back with you.
Okay, let's look at the landmark Affordable Health Care Act, which critics call Obamacare, or worse, but it's the Affordable Health Care Act. In your previous appearances on Voices of Experience, you have gone into some great detail on the Affordable Health Care Act. Some parts have kicked in already. Some parts will kick in future years. But what's available now, 2011, as a result of the Affordable Health Care Act that was not available to citizens previously?
Right. Well, you know, and this is a complex law that the Congress passed in March of 2010, and parts of it roll out earlier than others. Most of it will be fully implemented by 2014. But some of the key things that people can enjoy right now from the Affordable Care Act: insurance companies are not allowed to drop children with pre-existing medical conditions. That's going to be extended to everybody by 2014. They won't be able to deny you coverage based on a pre-existing medical condition, which of course is a big change from previous law. Some of the other things that have happened: insurers are prohibited from imposing lifetime dollar limits on coverage. That took effect in September of last year. That's really significant because many insurance companies that were covering people with serious illnesses, when they found out they had a serious illness, and the insurance company would just arbitrarily say, no, we're not going to cover you after your medical expenses exceed a certain amount. So as of September last year, they can't do that anymore either. The other thing that's in effect: insurance companies must cover the children of adult policyholders, the parents, on their policies until the children are 26 years of age. And that didn't exist before either. So those are just a few of the provisions that are in place in the law right now. More are going to be taking effect in coming years. In fact, one of the key things that we're going to be watching for, and that the state is involved, is setting up the so-called insurance exchange, which, think of the exchange basically as a marketplace where people can go to shop for private insurance policies. And so the legislature and the governor are going to be working on that in the coming year.
So this is changes that are built upon the free enterprise private company system.
That's right, right. It's really very misleading and I think very inaccurate for people to call this socialism or socialized medicine. In fact, most of this healthcare reform law is based upon private insurance. Yes, there is some expansion. There's significant expansion of the Medicaid program to low-income people, people with incomes up to 133% of the federal poverty rate. But the vast majority of this bill builds on what's in place already, which is private sector insurance.
Okay. Now for seniors, I recently had a senior physical or senior wellness exam. That's something that came into place with this law also.
That's right.
Yeah, and in fact, and I'm over 65, but for people turning 65 and receiving Medicare, they also have this they can start in on this free physical exam.
That's right. Getting these screenings to try to catch serious illnesses before they develop further. Because anybody who practices medicine would tell you that the earlier you catch a serious illness and begin to treat it effectively, the sooner you're going to address the underlying problem, and it's also much less expensive rather than waiting until an illness develops into something very, very serious. And when you hear very serious, you should read very expensive to treat.
Yes.
So that's why that provision was put in the Affordable Care Act too.
Specifically though, in 2014, what kicks in?
Well, by 2014, most of the federal law is going to be in place. A key thing, as I just mentioned, the state-based insurance exchanges. There's been some discussion. I know we've had some people in our state legislature who have said that Minnesota ought not to participate in creating a state-based health insurance exchange. I would just point out that if the states don't do it under the federal law, the federal government will draw them into a federally based insurance exchange. It makes a lot more sense for Minnesota to develop its own exchange that fits the needs of its citizens and its population rather than just waiting for the federal government to do it. So that's a key thing, is the insurance exchange. Insurance companies, as I mentioned earlier too, in 2014, they're not going to be able to deny insurance coverage to anybody for a pre-existing condition. Right now it's just the kids, but that will be expanded to everyone. Basically this issue of what's called universal issue, that if you can pay the premium, they have to issue the insurance policy to you by 2014. And so those are two of the very significant things that are going to be in place. The other thing, I should have mentioned this earlier too, Dan, I think one of the key things that your audience may be interested in when you ask me about what's in effect now is that we've gone halfway this year to closing the so-called donut hole in the Part D Medicare prescription drug benefit. As your listeners know, there's a big gap in there where you pay the premium and you run up against this wall where you basically have no coverage, but you're expected to continue paying the premium. Well, this year there's some relief for the seniors that they're getting a payment, I think it's of $250 this year, and then the gap would be totally eliminated by 2014. So that'll be one of the key things, is we'll get rid of the dreaded donut hole in Medicare prescription Part D coverage.
So you, on the word exchange, could you, I'm not exchanging with you.
No, and what it is, as I said earlier, I think of it as the marketplace. The exchange is where different insurance companies are offering different packages of benefits for particular premium. And it allows you to shop and compare who's offering what so that you can make a good decision on what's appropriate for you. For example, if you're a young Minnesotan, a married couple with perhaps a child or two, and you're just starting out, it may be important for you to have an insurance plan that has good pediatrics coverage, so you might look for that particular plan. If you're somebody with no children, you may have different health care needs. All of us do. And so rather than saying, you know, contrary to some of the critics of this law, one size fits all, no, the insurance exchange recognizes that different people have different insurance needs, and it's making sure that consumers have access to the information so that they can make an intelligent choice and an economical choice about what kind of health insurance they're going to have.
You mentioned Part D of Medicare, which is the prescription drug coverage.
Right.
And there is an important change that's coming about this year. The open enrollment period for 2012 will begin on October 15th of 2011 and then end on December 7th, Pearl Harbor Day. But the reason for that is for coverage effective January 1st, they have some time to complete the paperwork, even if it is electronic and all that. But the actual open enrollment period begins October 15th and ends on December 7th. So that whole thing is moved up a few weeks.
Yes.
And as always, it's a good time for retirees to look at their prescription drug coverage. Even if they are happy with the premium they're paying and the coverage they're receiving, it can change month by month. Your prescriptions can certainly change month by month, and it's always a good idea for retirees to review their prescription drug coverage.
Yes.
And if they're having trouble, they can contact the senior linkage line, which is part of the Minnesota Board of Aging. And they have some free, no cost advice, and they don't sell insurance or broker it at all. So it's a good source. But that open enrollment period begins October 15th. Okay, on the back to the Affordable Health Care Act. Steve, there have been various court challenges to the constitutionality of the act or other things. Some lower court decisions have been favorable to the act, some have been unfavorable to the act. Maybe before we proceed any further, we should talk about our court system, which is sometimes described as a ladder system or sometimes described as a three-tiered wedding cake. Do you want to explain that?
Sure. Well, the general process for those people or organizations that are challenging the constitutionality of a federal statute, you would bring a suit in the U.S. District Court for the state where you happen to live. And this, in fact, as you mentioned, this is what's happened in several of the states, attacking different portions of the law. But generally it would be heard and a judgment rendered at the district court level, and then the losing side would presumably appeal it to the next level, which is the U.S. Circuit Court of Appeals. Those of us here in Minnesota, we live in the 8th U.S. Circuit, which is based in St. Louis, Missouri, and it covers a number of states in the upper Midwest and the central Midwest. So if we had a challenge to the law from any of the states within that circuit, it would be the 8th Circuit that would hear the appeal. Then let's say that circuit court renders a judgment. Simultaneously, let's say there's a challenge occurring in the 4th Circuit or the 2nd Circuit, which is in New York, or the 9th Circuit, which is based in California. The circuit courts don't necessarily have to agree because reasonable people can come to different conclusions about what the law is. So if they don't like the judgment from the U.S. Circuit Court of Appeals, then the next step is the highest level of judicial review, or what's known as appellate review, and that's the United States Supreme Court. Most of the legal commentators who have looked at the constitutional issues involved in the Affordable Care Act think that it's probably inevitable that this case is sooner or later going to land at the doorstep of the U.S. Supreme Court in Washington. That could happen as early as the fall term this year. We shall see. There are some people, notably the Attorney General of the Commonwealth of Virginia, a fellow named Ken Cuccinelli, he had urged the Supreme Court to basically bypass the U.S. Circuit Court of Appeals and to take the case directly from a district court judgment that invalidated the Affordable Care Act, or part of it, and for the Supreme Court to bypass the circuit court and do an immediate Supreme Court review. The Supreme Court said, no, we're not going to do that. So I think what we're going to see here, Dan, is an orderly process where there are a number of cases. As you mentioned, the district courts are split on this. I think you could well see that a number of the appellate courts around the U.S. are going to be split on this too. Perfect scenario for the U.S. Supreme Court to grant what's called certiorari, which means we're going to review the case, and who knows when a decision could come out. I think one of the key parts that has been the subject of multiple challenges has been the individual mandate, the requirement that individuals, with very few exceptions, most individuals would be required to purchase what's called qualified health insurance by 2014, and that if you don't, you would be subject to basically a tax or a fee for not having done so. And we'll see what the courts do with that.
And the purpose of that is to make a large health pool, so you have don't just have people who are seriously ill who are trying to get the insurance. That we need broad participation.
That's right. And also you've got this problem that, you know, if we're going to provide access to health care for people, you create a scenario where if you don't have a mandate that people buy individual coverage, what happens when they get sick?
Yeah.
You know, I just learned in my household, my wife recently fell down the steps and she broke her big toe. Not a terribly serious injury, a painful one, but it did require a trip to the emergency room, and it required a trip in an ambulance.